Hello, my name is Dr. Fruitman. I'm a board-certified psychiatrist and I'm a medical director of Trifecta Health. At Trifecta Health, we help a lot of children and adults to deal with attention deficit disorder. So I feel like expressing my own personal professional opinion regarding that particular practice. There was a lot of attention that was given to the issue of attention deficit disorder overdiagnosis in the media. As a matter of fact, New York Times have written a couple of articles blaming overdiagnosis of attention deficit disorder on certain evils of capitalism, like drug companies and manufacturers of stimulants marketing to vulnerable parents, which of course led to overdiagnosis of the condition. Now the question becomes, who decides on the diagnosis of attention deficit disorder and how is it arrived at? Of course, it could be the parents who decide, it could be the teachers who decide, it could be the journalists who decide of who has attention deficit disorder and who doesn't. But I do suggest asking for qualified medical opinion. Nowadays, it's very easy to diagnose attention deficit disorder, and just in case the diagnosis is uncertain, it can be confirmed by very solid medical tests, like the EEG test that was just developed by NIBA, which is more or less a biological test that's based on brainwave function. I remember in the former Soviet Union, there was no such thing as attention deficit disorder, simply because all the citizens were supposed to behave well, to listen to the government, and such diagnosis was not in existence. I think in America, people are allowed to have attention deficit disorder and are allowed to be medicated for the condition if they need help. Such diagnosis should be based on very sound medical judgment. In case physician is wrong about diagnosing attention deficit disorder, in cases where it gets overdiagnosed, the remedy, the prescription for it, will show that such a decision was wrong. If a stimulant is prescribed to a person who does not have attention deficit disorder, it's very likely to do more harm than good. Certainly would not improve the behavior of a child, and it's unlikely to help an adult being more productive. I doubt very much that there are many patients who got overdiagnosed with attention deficit disorder and as a result over-medicated, because such practice is very unlikely to be helpful. Come and see me. I'm Dr. Fruitman. Come see us at Trifecta Health, where we'll help you resolve any questions or dilemmas about attention deficit disorder diagnosis.